nutritional diseases of sheep and goat. All we talk about introtoxemia. It is very important disease of goat. And usually what we find here that there will be digestive upset, there will be diarrhea, stomach pain, and there will be lack of coordination. The animal will kick the belly, it will lay down, get up. If it is not taken care of, the animal will go in coma and resulting into death also. So it should be taken care, this enterotoxemia. This just see the classical posture of goat, which is suffering from enterotoxemia. Usually, a frequent, a small volume feeding of milk, grain, and forage should be given. Should be given frequently. A small volume feeding of milk or grain, forage should be given frequently, because large meals, it will not eat also. Large meals fed at once, it should be avoided. And where there is risk, the population of goat where it is at risk, or where already there is enterotoxemia, we should feed good quality of forage as energy or protein supplement instead of cereal grains. This is very important. So time and again I'm repeating, I'm emphasizing on this. Good quality forages should be given as energy or protein source instead of cereal grains. And because of this, the fermentable carbohydrate intake will be reduced, and so the animals will not have such kind of problem. Another disease is polyencephalomalacia. We can see in this, the symptoms will be aimless wandering or suckling. There will be cortical blindness. There will be loss of appetite. Extensor spasms will be there. Star grazing posture, head pressing will be there. So if we see this type of symptoms, we can imagine that it can be a case of polyencephalomalacia. So just see the picture. This is the star gauging postures. So this can be treated with a feed like thiamine. Vitamin. It is a vitamin. So thiamine can be given 200 to 500 milligram intravenous, intramuscular, or subcut in any type. Depending upon the condition, you can use this thiamine. In case of feeding, the grain should be reduced, forage intake should be increased, and if it is necessary, then excessive sulfate or sulfide intake should be reduced. If it is given as in mineral mixture or something like that, it should be decreased. Excessive should be decreased. Thiamine mononitrate used in the diet also, and if it is used in the diet, it may aid in prevention of polyencephalomalacia. Another disease is white muscle disease. If we see the symptoms, there will be arched back, pneumonia can be there, and the stiffness, especially in hindquarters, are there. Acute death can be there. If you see the necropsy, the white striations will be found in cardiac and skeletal muscles. You can see this arched back. So this is caused by low levels of selenium and possibly vitamin E. So as already emphasized, we have to give a mineral mixture containing selenium. It develops less frequently in goats. It is usually seen in sheep. Urinary calculi, it is usually found. You will see that there will be stomping of feet, kicking at the area of penis, straining will be there, difficult, painful urination, blockage, or slow urine. So we can consider it to be urinary calculi. Such type of symptoms. In this condition, phosphorus should be lowered. Phosphorus consumption should be lowered to minimum level, and calcium phosphorus ratio should be maintained at more than 2:1. And here the use of anionic salts such as ammonium chloride, ammonium chloride should be done. That is 0.5% of the complete diet. And tetracycline can be used in the diet. Adequate vitamin A intake should be there. Dietary intake of salt should be increased. Grain intake, again, it should be reduced. So we can see that at many places, grain intake has to be reduced, and pelleted cereal grains has to be minimized, and adequate source of fresh, clean, palatable water free of choice have been proved to be beneficial. In human being also, we see that when there is calculi of any type, we are advised to take lot of water. So in animals also, we should provide fresh, clean, palatable water. Giving salt in this, when we use salt, the animal will take more water. one more disease that is we can in these are the metabolic diseases. Metabolic diseases, we have ketonuria, and in that we have increased blood level of ketone bodies. There is hypoglycemia, and death can result if we do not take care of the animals at proper time. So in this we can see that hypoglycemia will be there. Pregnancy toxemia, we see grass staggers, many diseases. We have many metabolic diseases like hypocalcemia, pregnancy toxemia, grass staggers, and these are the common metabolic disease. And so in late pregnancy use, we have to lower calcium diet, and so that the calcium that the animal body is ready to make use of calcium. They have calcium, we have calcium in our bones, but it is not using the calcium. So once we lower calcium in the diet during the late pregnancy use, it will start using the thyroid gland hormones will be released, so that the calcium is mobilized from the bones. It is not a case of low calcium, it is a case of low mobilization of calcium. So decreasing during the last pregnancy, it helps in calcium mobilization after the lambing or after the kidding. So and optimum amount of energy protein supplement must be given, because if it is lessen, the energy is less and metabolic diseases can result. Here it is anionic feeding should be practiced here, not mineral feeding as such. Mineral anion should be fed to avoid these metabolic diseases. And after lambing or kidding, calcium and vitamin D intake should be increased. It should, after lambing, before lambing, it is lowered, but after lambing, it should be increased. Farmers should take care that when there is going to lamb, should have optimum scoring. It should be not underweight or over conditioned. We have to take care. Already we have talked about this, that it should not be under conditioned. It should not be fatty. It should not be over conditioned. So farmers must take care it during the pregnancy period. Mostly it is seen that during the pregnancy period, we take much care of these animals. So if we want economical farming, we have to take care of the animals during pregnancy and during lambing, and of course after that. So this metabolic disease we were talking about, we can see that if feed intake does not meet the energy demand, there will be insufficient ruminal production of propionic acid, which is a precursor of glucose. So if glucose is not enough, if propionic acid is insufficient, glucose will be insufficient. If glucose will be insufficient, hypoglycemia will be there, means low blood sugar will be there. If low blood sugar is there, then that will metabolize the fatty acid and glycerol supplies. Then what happens? The fatty acid and glycerol, that will oxidize to form acetyl coenzyme A. And if there is excess of acetyl coenzyme A, what will happen? It happens due to lack of energy. If there is lack of energy, excess of acetyl coenzyme will be produced. It is converted to ketone bodies, and that result in ketosis. That is a major metabolic disease that we can find. So ketone bodies will accumulate and excreted in milk and urine. If you want to see again, this is the case. This is just how ketosis occurs. Here again I am repeating, if the feed intake does not meet energy demand, if energy is not fulfilled, what will happen? Propionic acid will be produced less. If propionic acid is produced less, it is a precursor of glucose, so glucose will be produced less. If glucose is less, it will be hypoglycemic, low blood sugar will be there. If blood sugar is less, then it will metabolize fatty acid and glycerol. If fatty acid and glycerol, then this will be converted to acetyl coenzyme A, and acetyl coenzyme A will be converted to, if it comes in excess, it will be converted to ketone bodies, and they will lead to ketosis. Ketone bodies will be accumulated and excreted in milk and urine. So liver is not able to cope up if there is lack of energy. Thank you.